And I think that's the first thing to understand, because oftentimes Republican plans seem complicated, and it's because we're trying to look at this system that has been heavily controlled by government regulation for decades and decades and decades, and see where we can introduce the power of competition, of free markets, and of patient choice. So one of those, I think, fundamental issues is that we talk about healthcare insurance, but it's not the same thing as when we talk about, for example, car insurance, right? So car insurance we get for accidents, for things that are unpredictable in the future that might happen to anybody. And then we use insurance to cover the risk for those things. But what people consider health insurance now, especially under Obamacare with all of the mandates that they heaped on it, is maintenance, right? It's things that costs we know we're going to incur, such as annual physicals or very common reasons that people visit the doctor for. If you heap those things onto insurance, you're going to end up paying even more in the long run and raise costs even more in the long run, because in order to make money, the insurance company is going to have to charge whatever that treatment costs that they know you're going to use, plus more for overhead and profit. And so all of those regulations and heaping more and more things onto insurance, that's one of the major drivers that Obamacare has forced premiums up. Right? We heard a lot about this in the birth control context, right? The birth control mandate from HHS, that actually made all of our insurance more expensive, and oftentimes more expensive than what birth control would have cost off of insurance, because you have to make room for that overhead and those costs. Multiply that mandate, which got a lot of attention, by thousands and thousands, and that's what's happened to the cost of insurance. We should allow especially healthy young people to purchase actual catastrophic insurance for major things that people can't predict: accidents, cancer, heart disease, horrible, expensive medical treatments that are not part of the normal routine of going to the doctor. So that's one. That's kind of one of the basic problems in our system. One of the other ones is just the fact that we've tied it up with insurance, which actually goes back all the way to FDR and plans like AOC's to jack our tax rates really, really high. So companies started to try to compete not with the salary, but with benefits that weren't taxed, right? So then we got this system that grew out of that, where we tied healthcare insurance to our employment. That was just a really bad plan from the beginning, because it meant that oftentimes people, as they change jobs in their 40s and 50s and they have healthcare problems, that created what we now see as a pre-existing condition crisis, right? Where people who have pre-existing conditions in their 50s have a hard time getting reasonable cost health insurance. And I say all of this just to say that, Republican solutions, we're trying to slowly undo some of this web of government intervention into the healthcare system that has caused a whole bunch of unintended consequences and really, really expensive costs.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.